1. What is the primary purpose of behavioral observation and screening, but in clinical settings? A. To diagnose medical conditions. B. To assess an individual's psychological well being. To observe and document behavior for further evaluation and intervention. D. To provide counseling to patients. 2. During a BOS session, which of the following is most critical when recording an individual's behavior? A. Subjective interpretation of the behavior. B. Specific factual details of the observed behavior. C. Assumptions about the person's past experiences. D. Speculative analysis of the behavior's cause. 3. Which of the following is a key component of an effective behavioral observation? A. Speculating about the patient's thoughts and emotions. Documenting the duration, frequency, and intensity of the behavior. C. Providing immediate feedback to the patient during the observation. D. Making assumptions about the underlying causes of behavior. 4. In the context of behavioral screening, what is the purpose of establishing baseline data? A. To make immediate medical decisions. B. To compare future observations and detect changes in behavior. C. To evaluate the effectiveness of treatments immediately. D. To diagnose psychological disorders. 5. Which of the following is a common challenge faced during behavioral observation and screening? A. Observing behavior in a controlled environment. B. The need for objective and consistent recording. C. Analyzing the behavior without any external influences. D. Ensuring the patient is fully aware of being observed. 6. When mentoring individuals in behavioral observation techniques, which strategy is most effective? A. Encouraging immediate judgments based on the first observation. B. Emphasizing the importance of being non-judgmental and objective. C. Encouraging personal opinions to guide the assessment. D. Focusing solely on the emotional reactions of the individual observed. 7. How should behavioral observations be documented for accuracy and consistency? A. Using short anecdotal notes to summarize the behavior. B. Writing brief descriptions based on feelings and impressions. C. Recording detailed, objective descriptions with specific examples. D. Focusing on the observer's interpretation of the behavior. 8. What role does communication play in behavioral observation and screening? A. It is not relevant in the observation process. B. It helps facilitate better understanding between the observer and the person observed. C. It is only important during the final evaluation phase. D. It is used primarily for reporting the behavior to others. 9. What is an ethical consideration during behavioral observation? A. The observer's personal beliefs about the behavior should guide the evaluation. B. The person being observed should be informed of the observation and its purpose. C. The observer should influence the behavior to ensure it's correctly observed. The observation should only focus on positive behaviors. 10. What is the role of feedback in the behavioral observation process? A. To provide immediate judgments about the individual being observed. B. To help the individual adjust their behavior during the observation. C. To offer insight into the observed behavior after the fact for further learning. D. To criticize the individual's actions immediately after observation. 11. Which of the following methods can improve the accuracy of behavioral screening in an educational setting? A. Implementing a variety of observational tools and techniques. B. Relying solely on teacher reports without observation. C. Ignoring the behavioral context and focusing only on outcomes. D. Only using one observer to minimize bias. 12. How should a behavioral observation screening tool be designed for consistency? A. By allowing observers to use their judgment in defining behaviors. B. By focusing on a set of specific measurable behaviors. C. By encouraging flexibility in how behaviors are documented. D. By avoiding predefined criteria to ensure creative freedom. 13. What is an example of a behavioral screening tool used to monitor mental health in a clinical setting? A. Blood pressure readings. B. Self-reported questionnaires. C. Structured interviews. D. Rating scales for depression and anxiety. 14. Which of the following is a challenge in behavioral observation and screening for people with developmental disabilities? A. The observer's personal biases are irrelevant. B. Identifying specific behaviors without making generalizations. C. Observing and documenting behaviors in real time. D. Over-relying on standardized testing methods. 15. How should data from behavioral screening be interpreted? A. By making assumptions about future behavior. B. By considering the individual's history and context while analyzing the data. C. By focusing solely on a single observation to make judgments. D. By comparing the results with the general population without any context. 16. Which method is often used to improve the reliability of behavioral observations across multiple observers? A. Using a standardized observation checklist. B. Allowing each observer to make decisions based on personal interpretation. C. Relying on general statements about the observed behavior. D. Focusing only on nonverbal communication. 17. When conducting a BOSR session, which of the following is most crucial to the process? A. Allowing the individual to perform as they would without any guidance. B. Observing over a long period without interruptions. C. Focusing only on immediate actions without any consideration of context. D. Ensuring that behavior is observed in a structured and consistent manner. 18. How can a prevention specialist use BOSR in community-based interventions? A. To provide treatment plans based on a single observation. B. To assess the effectiveness of preventive programs by observing behavioral outcomes. C. To replace traditional methods of intervention. D. To document incidents without interpreting the results. 19. What is a potential consequence of failing to document behavioral observations accurately? A. A delay in treatment planning or intervention. B. A more effective behavioral intervention plan. C. Enhanced understanding of the individual's needs. D. Increased satisfaction from the person being observed. 20. How does behavioral observation support the overall diagnostic process? A. By providing raw data that can be further interpreted by other professionals. B. By directly diagnosing mental health conditions without additional assessment. C. By eliminating the need for any other forms of assessment. D. By focusing exclusively on observed behavior without considering underlying issues. 21. What is a primary concern when conducting behavioral observation in a classroom setting? A. The accuracy of teacher reports versus direct observation. B. The amount of time spent observing students. C. The impact of the observer's presence on students' behavior. D. The type of documentation system used for behavioral data. 22. In an organizational context, how can behavioral observation be used to improve employee performance? A. By identifying areas where additional training or development is needed. B. By allowing managers to criticize employees during observations. C. By relying solely on self-reporting by employees. D. By reducing the need for other forms of performance assessment. 23. What is the most effective way to handle subjective biases during behavioral observation? A. Ignore them to focus on results. B. Use structured tools and standardized methods to guide the observation. C. Rely solely on intuition and personal experience. D. Encourage all observers to interpret the behavior in their own way. 24. Which of the following is an example of an objective method used in behavioral observation? A. Observing body language without making conclusions. B. Rating the frequency of specific behaviors based on clear criteria. C. Relying on personal judgment to assess behavior. D. Making assumptions about a person's intentions based on their appearance. 25. What is the key role of an observer during a BOSR session? A. To interact with the individual being observed. B. To document all relevant behaviors accurately without interpretation. C. To intervene and correct the behavior immediately. D. To assess only nonverbal behaviors. 26. What should an observer do if they notice a change in an individual's behavior during the observation period? A. Ignore the change, as it may not be relevant. B. Document the change and note any contextual factors. C. Assume that the change is permanent without further analysis. D. Focus on the change without considering the context of the situation. 27. Which of the following should not be included in the behavioral observation data? A. Details about the individual's behavior and environment. B. Speculative thoughts about why the behavior occurred. C. Specific, measurable descriptions of the observed behavior. D. Information about the duration and frequency of the behavior. 28. Which of the following best describes a behavioral observation checklist? A. Detailed document listing every possible behavior to observe. B. A tool that helps structure and guide the observation process to ensure consistency. C. A tool that only provides broad categories for observation. D. A method that encourages subjective analysis of behavior. 29. How can behavioral screening data be used to enhance intervention strategies? A. By providing a clear, data-driven picture of the individual's needs and challenges. By assuming that the person's behavior will remain constant. C. By focusing on the individual's personal preferences. By using the data to exclude individuals from certain interventions. 30. What is the importance of context in behavioral observation and screening? A. It provides background information to help understand the behavior being observed. B. It is irrelevant as behavior is always the same in any setting. C. It only matters when the individual is observed for the first time. D. It is more important than the behavior itself.